Hello, all. Welcome back to the last episode of the story series under the theme of Ayati Kamat Mahotsav by Momish Dominance. Today, I am going to introduce you a very noble soul who has devoted all her life in saving the lives of other people, that is, the cancer patients. We can also call her as a beacon of light for the people who are suffering with cancer in the mid 19th century when there was no hope for cancer at all. The awareness of cancer is not there in the public nor in the doctors at that point of time. But this lady, though short in stature, has taken a big leap and given the utmost care and treatment for the patients. And she's none other than Dr. V. Shantha from the Cancer Institute of Adyar in Chennai. She was born in a very industrious family in 1927 in a very small hamlet, which was now called as Chennai, which falls under Chennai. That is a small area in Chennai called Mylapore. She is the grandniece of C.V. Raman, Sir Chandrasekhar, and all. Following her lineage of the so many great people in her family, she has chosen that she should become a doctor based on the influence of Dr. Muthulashmi Reddy, who is the first MBBS doctor in India. Though she's come from a very traditional family, she was not afraid to step out of the boundaries of the of her traditional family and undertake the medicine as a vocation. And she was willing to go ahead with the surgeries and and she was able to do a lot of operations, postmortems, everything during her medical course, which is needed for any medical student. Her first brush with Dr. Krishnamurti, S. Krishnamurti, who is the son of Muthulashmi Reddy, came in and when she was doing her house surgeon in the government hospital of Chennai. At that point of time, Dr. S. Krishnamurti was handling the cancer ward in the government hospital in Chennai, and he was treating a lot of cancer patients for whom there is no hope. And most of the people used to run away from the cancer ward, and none of the doctors were willing to take up the duties in the cancer ward. But here is one unique person who has studied about cancer and its treatment in USA, but returned back to India to save people in India because cancer is known or treated as the disease of the fate, saying that people will get this disease, cancer, only if they had done some bad karma or bad deeds in this either in this birth or in the previous birth. Some people say that it's a gift of God to punish the people, and there was no awareness, and the fatality rates of cancer were very high at that point of time. Dr. Muthulashmi Reddy, along with her son, has established a 12-bed cancer institute in a thatched roof, more like the Gandhiji Sevagram style in Gujarat, with the help under the umbrella of Women's Indian Association. This is we can say that it is fallen under the bigger umbrella for women's rights for equality in the newly independent India. And after working as an intern for Dr. S. Krishnamurti in the government hospital, Dr. Shantha wanted to, basically work along with Dr. S. Krishnamurti and her own idol, that is Muthulashmi Reddy, in Cancer Institute. And that's why she has joined as one of the honorary doctors with a very meager pay. But in 1955, and that is the time when she stepped into the Cancer Institute for the first time. And from 1955 till 2021, she never stepped out of Cancer Institute for any of her family duties. And she has devoted her entire life to the Institute, and she got trained by the two excellent doctors who are experts in their own right in the treatment and in the care that needs to be given to the cancer patients. Today, if the Cancer Institute has grown to a bigger hospital which can accommodate 423 beds, and is working across two different campuses with multiple doctors and treating and using multiple disciplinary approaches to treat the cancer patients. That's all due to the efforts of Dr. S. Krishnamurti and Dr. Shanta. And we cannot say that, we can actually say that the cancer institute today is being treated, can be considered as one of the topmost research institutions, cancer research institutions in across India, not only India, in fact in the entire world. And so many people, the doctors, the research medical researchers, everybody would like to come and have conferences with Dr. Shanta, discuss with Dr. Shanta, understand her research projects, work along with her. I mean, who the people who are very famous in the cancer research across the world, across different countries, always would like to put their foot into cancer institute at least for once, so that they can spend time with this illustrious doctor, understand from her knowledge, and learn more from her. Initial days, the people at the Cancer Institute was like Dr. S. Krishnamurti, Dr. Shanta, all these people were spending time more and more in research to understand what are the different types of cancer that comes, how they can treat in a with a very meager means of income. I already told you that this started as under the umbrella of the WIA, right? Women's Indian Association. So obviously, this is an NGO. This is not a private hospital in which people can collect as much as fees as it is possible. All the fees here is collected based on the income level of the patients, and the main aim of Dr. Muthulashmi Reddy, Shanta, and Dr. S. Krishnamurti is to provide cancer care in the similar way as what the richest people across the world can get at a very nominal price. So the treatment cost would always be bearable to the poorest of the poor people. In fact, she has work with so many people to get the donations across the country, across the globe, to pay the fees of the doctors. I mean, salaries of the doctors, other medical professionals, nurses, and also to take care of the food. In fact, that in the initial years, till the time Dr. Muthulashmi Reddy is alive, she used to cook food. She used to make her people, or she herself sometimes used to cook food for all the cancer patients who are staying in their hospital and deliver the meals, and she should serve them individually. This incident shows you how much care and concern all these three pillars of the cancer institute were providing to the initial patients. Dr. Shanta has become the pioneer in the oncology research in India, and under the strict support and observation of her mentor, Dr. S. Krishnamurti. In fact, she has convinced Medical Council of India that oncology needs to be treated as a separate science, and we need to have specialized courses and research programs to understand more about the different disciplines in the oncology, how the cancer in various parts of the body will affect, and what are the treatments that we need to give. And she is one of the first people to establish a pediatric oncology ward in 1960. I mean, it is one of the maybe very few pediatric wards in which treat the leukemia cancer in the kids across the world, not just in India. And the kids here always call her atte, or I mean, that is aunt or granny, with love and affection. And Dr. Shanta, remembers each and every kid's name, their history, how they came here, what are their passions, what are their interests. And she always believes that I mean, basically, they as the doctors should provide the confidence and the support to the kids so that they can have a brighter tomorrow later. It's not that all the kids who are got affected with leukemia have to die. Uh, Under her research and guidance, the fatality rate in the leukemia kids has reduced from 58% to less than 10%, which itself is a substantial number considering the way leukemia kids were suffering at one point of time. She has the another best act which she has done is she has started maintaining the cancer patients history, because at that point of time, I'm talking about 1960s and 1970s, where cancer is not that very famous, right? People, if at all, if people are coming, they are coming at a later stages of the cancer, not in the initial stages. And after the first treatment, they should run away from the hospital and not return back for the follow-ups. And that is why they were losing most of the patients because of the negligence, or because of the ignorance, we can say. So Shanta is in Dr. Shanta is instrumental in starting the central cancer registries. It's a registry where all the details of the patients would be recorded right from their place where they stay, what is their income, how the where they are getting treated, how they are getting treated, and all the stuff. And in fact, she's known to have sent people to villages across Tamil Nadu and Andhra Pradesh in search of the people who have not turned up for follow-up checkups, and bring those people so that they can get the timely care and treatment. That shows, I mean, you can really understand how concerned she is about her patients. But she remembers, and she has a very bright memory, in which she remembers each and every patient's name, and she establishes an individual connection with each and every patient. In fact, Dr. S. Krishnamurti told in one of his interviews that the way Dr. Shantha attends to her patients is totally different from when compared to all the other doctors, because doctors can provide do surgeries or can give the treatment plan, but ensuring that the patients follow the treatment plan diligently, and ensuring that post the treatment is over, the patient is getting rehabilitated properly, and also ensuring that the patients lead a life post this treatment is also the job of Dr. Shanta. She should take care of everything, and she is one of the key instrumental persons in convincing Indian government to start issuing statutory warnings on all the tobacco related products, saying, you mean we need to kill the tobacco or stop using cigarettes, or cigarette smoking is injurious to health. She also convinced Indian Railway Department to issue discount passes to all the cancer patients, because already they are suffering from a disease which is little expensive. Though their cancer institute is providing so many discounts and giving the treatment at a discounted rate, but still, for a day laborer, this is a very big expense for traveling from their own native place to Chennai. So she convinced the government officials from the Indian Railways team department, and now Indian Railways department gives the 50% discount passes for all the cancer patients. She also started working as a WHO oncology advisor till her last breath. From and she's one of the very few people who has worked continuously for a long term on the WHO advisory board. That's all because of her hard work and dedication towards cancer and the research. When one person asked her, where do you get time for all these things? You're taking care of the patients, you are available on the support, on-call support as a doctor 24 by 7, and you're doing research, you are counseling the patients. She just smiled and mentioned that what else I do? I have life. I've been sent here by the God to help these people. She also roped in all the people who got cured of cancer and went back as a counselors back into the cancer institute. So especially for the ladies, the breast cancer patients, the cervical cancer patients, because she knew that most of these cancers can be treated if they are detected at an earlier stage, but most of the people neglect it because they don't know the symptoms. And she started spreading awareness of different forms of cancer by using this people who got cured because of the cancer to counsel the patients who are suffering going through that hardships. She is the recipient of three Padma Awards, Padma Shri, Padma Bhushan, and Padma Vibhushan. But she never used a single penny from her end, and she directed all of that into the research, cancer research, and the cancer treatment. Always, the Cancer Institute used to fall short of funds, and she is the one person who is instrumental in approaching the dignitaries, the government officials, sponsors, so that the gap between the actual expenses and the treatment plan could be met, so that patients will not go empty handed without any treatment. Her main aim at the end of the day is that none of the patients who enter the cancer institute premises in Adayar of Chennai will turn empty handed. They have to get the treatment at any cost, and for that she is to ensure that she can talk to as many people as possible. Most of the research scholars across the world, medical researchers who come into cancer institute, used to willingly donate from their pocket, because nobody is forcing them, but the amount of work she has done for the cancer institute has moved them, and most of the people would either spend their time helping Dr. Shanta maintain the records, administration stuff, counseling the patients, taking care of a lot of other things. And some people should give the monetary benefits, monetary donation. Some people used to send them basically the food for the patient. Some people used to give employment. Some business tycoons used to give employment for the people who got cured of the cancer. So in a way, she's all over the life of the person once if he's impacted with cancer and enters into the Cancer Institute of RDR. She is the first person who has spearheaded the campaign saying cancer is curable, prevention is better than cure. And as I told you, till the time she passed away in January 2021, she was always living in a single bedroom on the top of the on the upper stairs of the Cancer Institute, along with her sister, and they should live in a very austere life without going any extravaganza. And she always used to feel that current days medicine has turned into a business where patients are being treated as a commodity and thinking that they can extract money out of the patients. But here is one institution which is working along with the private institutions on top of it, on top of the private institutions in the type in terms of the care and the concern and the treatment given to the patients. But at the same time, charging at a very lesser rate when compared to even the public medical institutions. She proved that anything can be possible in the world if you have a good will. In fact, her last wish, even while dying the on the day when she passed away, is to sprinkle her ashes all over the cancer institute so that her mortal remains will still stay in cancer institute and ensure that things will flow in a smoother way. When one of the journalists has asked her after she received the Padma Vibhushan Award or Magsaysay Award, saying that how do you ensure that your legacy will get carried forward in the future as well, because nobody is immortal. For that, she mentioned that I know I'm not immortal for immortal being, and I have already set up processes and principles in place so that nothing gets changed in the cancer institution, and it will stay as is in the similar, it will work in the similar voluntary way without any expecting any benefits. Though the doctors are hard pressed for time, the nurses are overworking, the all the we will find some route other than, and there are so many leaders behind me who can take care of this cancer institution. That shows the actual leadership qualities in her, because most of the people will not leave the legacy, will not identify the second set of leaders at any point of time, and that is where most of the organizations fail. But here is one lady, a lady though short in stature, identified her second level of leaders who can carry forward their legacy. She carried forward the legacy of Dr. Muthulakshmi Reddy, Dr. S. Krishnamurti in till 2021. And now the second set of leaders are taking forward the cancer institution's legacy into future. So and no wonder we can call her as the Mother Teresa of cancer patients, or the lady with the lamp for the cancer institutions, or the beacon of light. Whatever may be the name you want to give, Cancer Institution, RDR, and Dr. Shantha both go hand in hand. If even even in the future, because the way she has contributed to her life, the Cancer Institution is totally uncomparable, and nobody can beat her in this regard. That's all is a story for my today, my dear friends. And that the reason why I had picked her story as last story is because medicine has become such a competitive and expensive profession these days that most of the people are afraid to get into any hospital. But here is one lady who kept her doors open for all the poor people, day laborers, wage workers, so that the biggest malady of all the diseases, that is the cancer, can be cured, and these people can go back to their homes and families with happy faces. I hope you like this story. Stay tuned for more updates from me. Thanks a lot for supporting me in my story marathon under the theme of Ayadi Kamrit Mahotsav. I hope you liked at least some of my stories, if not all. Please do let me know your comments and your thoughts on this entire story marathon. I will eagerly looking forward for more of your comments. Thank you.